This is a major concern for so many families, especially with the rise in the Omicron variant. But medical personnel, they've warned about a strained U.S. healthcare system even before COVID-19, long before the pandemic. But it has also taxed doctors and nurses to critical levels. They've worked long hours. They've had to make do with very limited resources. And in many cases, they've had to wear multiple hats, some contracting the virus themselves. And in even worse, some have passed away. Some have died as a result. In August, we saw an alarming spike, this all happening during the height of the Delta variant and after COVID vaccines became widely available. We're joined right now by Dr. Jay Bott, a primary care physician and instructor at the University of Illinois School of Public Health. Dr. Bott, thank you. You wrote about this issue in a recent op-ed, how many healthcare workers have actually not just become sick, but died from COVID since the start of the pandemic. Was this surprising to you?
Thanks for having me on this morning, and good morning. I found it surprising in the sense the escalation, certainly of deaths during that time. Again, not surprising that we saw healthcare workers die. You know, as we go back to early in the pandemic, we knew there were challenges with PPE. We knew that folks were on the front lines with very difficult circumstances. And so, we expected that to happen, particularly when we didn't have vaccines and treatments. Given that there were vaccinations in 2021, but yet 30% of healthcare workers being unvaccinated poses a problem to not only other healthcare workers, but the public as well.
To what do you attribute so many deaths? Obviously, there is an unprecedented amount of pressure on the healthcare workers in our country, and no doubt it was exacerbated by this pandemic. But why the deaths?
So during the first week of August in 2021, we had 70 healthcare worker deaths as documented by the CDC, and it went to 109 in September and then declined again by late September. And so I think there's an inflection point in which we had rising cases of Delta, more than 30% of unvaccinated Americans, kids returning back to school, along with employers reopening offices in parts of the country. And I think not, again, taking these surges seriously like the one we're having now. I think folks need to take these situations seriously, including healthcare workers who are not vaccinated.
But what is the answer? Because short of vaccination, there are a lot of healthcare workers who are burnt out. They want better benefits. They're not able at this time with the shortage of staff to really live that work-life balance. What needs to change, do you think, for the profession, for preserving healthcare in this country?
Well, I think, one, we got to certainly go back to the basics. We've got to support healthcare workers appropriately, invest in them, invest in the systems that support them, reduce administrative burden that they face, as well as supporting them with the various tools to help protect them, but also support their mental health. We know that mental health can be a challenge for many during this time and throughout, their time in healthcare. So I think that we've got to do more with clinicians and administrators working together to support our healthcare system, because if we're not, we're continue to be strained, and that's the thing that keeps me up at night.
It keeps you up at night. What are you most concerned about, and what do you think most Americans should be concerned about?
I think I'm concerned that not only will there not be healthcare workers and clinicians to support those with COVID, but there won't be those to take care of people that need it for other conditions that are significant, whether it be chronic disease, cancer, heart disease, stroke, trauma. So I think that we're seeing already that Omicron's impacting staffing, not just in healthcare, but on airlines and other industries. But in the place where we need it most right now, it's being strained. And so, we can't have situations where hospitals are going back on their mandates. We've seen some health systems do that. We know that vaccines work. We know that they can be one of the elements to protect. But we also, I think with the recent guidance from the CDC, also driven by science, and I think the science supports the isolation and quarantine requirements. But the thing that's missing is testing. And testing negative before we have healthcare workers go back to work. which I think is important.
Well, I think short of having to change the entire system, which will be a task of mammoth proportion, maybe all of us can challenge each other. Those of you watching at home can write a letter thanking your medical healthcare professionals next time you go to the doctor's office, or maybe mail them a card and just tell them how much you appreciate them. So thank you, Dr. Bott. It's always nice to be appreciated, and we certainly appreciate all of those who have done so much for us to keep us healthy.
Thank you so much. Really appreciate that.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.